Good afternoon, everyone. Thank you for joining us for our St. Luke's Virtual Health Talk presentation today, where we bring health information and education to the people and the communities that we serve. Today we have Katie Quaglia and Sarah Armstrong from our physical therapy team in the Wood River Valley. They are both doctors of physical therapy and certified lymphedema specialists. We're really happy to have them here today, and we're really grateful for those of you out in our audience attending today. Before we get started, I would like to just let you know a few details that are important to these presentations. The first is a disclaimer that St. Luke's has. If you guys could switch to that first slide, that'd be great. The disclaimer is just to let you know and remind you that the information contained in this video shouldn't be construed as medical advice or instruction. If you do need medical advice, please contact your healthcare providers. This video and all the content is such as the video, the text, the graphics, the trademarks, logos, etc., are property of St. Luke's Health System and our community partners or our prospective licensors. So this video is being made available to our registrants for a limited time for our personal and non-commercial use only, and for educational information that is provided. So again, thank you for that. And then lastly, I would like to just remind you that throughout the presentation, please type in your questions, and on your computers, usually in the top right side, you will see a little conversation bubble with a question mark in it that says Q&A underneath. And if you click on that, you will be able to type in your questions. We will be monitoring those questions and getting them to Sarah and Katie as we move forward. But please type in your questions as you think of them, and we will make sure we address them at the end of the presentation. If it's something pertaining to a particular slide, we'll try to interject those questions as we move along. To send the questions in, a further note you'll see that little airplane kind of symbol. Just click that and that will make sure that your question gets delivered to us. So without further ado, Katie and Sarah, thank you again for joining us, and it's all yours.
Thank you, Erin. So welcome to our talk on lymphedema and complete decongestive therapy. We're thrilled you guys were able to join us this afternoon. So I'm Sarah. I'm a physical therapist up in Ketchum. I grew up in Idaho, so I grew up in McCall on a ranch up there, and grew to love skiing, rafting, all those fun things that we do here in Idaho. I went to the University of Puget Sound for my undergrad and got a degree in geology and environmental policy. I worked for the Forest Service for about 10 years, started out in fisheries and progressed to working in fire. I worked on a hotshot crew and a couple rappel crews before returning to school at University of Puget Sound to get my Doctor of Physical Therapy degree. While I was there, I did research, and my research was in lymphedema therapy for the treatment of complex regional pain syndrome, which is a pain syndrome where the pain is actually no longer generated at the point of a tissue injury, but actually becomes centralized and it is essentially created in the brain. So people's experience of pain is no longer at the point of the tissue injury. So we looked at how lymphedema therapy could help with that. I also got to spend 2 of my rotations at St. Charles in Bend, and I got to spend a couple days in the cancer center there and started getting exposed to lymphedema treatments, and I found it to be really fascinating, and it's very cool to get the opportunity to work with the different populations that the lymphedema therapy hits. Once I graduated, I got my first job with St. Luke's, so thank you for hiring me, St. Luke's. I ended up here in Ketchum. I worked inpatient or in the acute care setting for 3 years. And in January of 2021, I switched over to outpatient. And then this year, in May, I was able to get my certified lymphedema therapy qualification. And in August, I took my LANA certification. That's like our governing agency that kind of makes sure that we're all on the same page in terms of how we're practicing. And that's the Lymphology Association of North America.
So my name is Katie. I work at the Haley Clinic in outpatient physical therapy. And just like Sarah, I also started at the hospital in Ketchum and worked there for a few years before I switched to the clinic. I've now been at the Haley Clinic for about 6 years. And prior to that, I moved up here from Salt Lake City, where I worked at the Huntsman Cancer Institute. So that was my first experience with lymphedema. I worked in the hospital, but many of the patients there also had lymphedema. I worked at the Huntsman Cancer Institute after completing my Doctor of Physical Therapy degree at the University of Utah. And prior to that, did my undergrad back east. While I was in Utah, I was able to come up to the Wood River Valley kind of for fun and exploration. And when a job came opened at St. Luke's, I felt ready to make the switch up here. I am a lymphedema therapist like Sarah. We went to a 9-day class together this April and May. Prior to our class, we completed I think it was about 45 hours of kind of individual coursework through videos and a large manual. And then our class was 9 days of intensive hands-on coursework with 2 different instructors. Our class was made possible by the St. Luke's Wood River Foundation. In addition to the foundations in the Treasure Valley and Magic Valley, St. Luke's was able to roll out 30 new lymphedema therapists system-wide that include therapists in the outpatient setting, like Sarah and myself, and in addition, hospital care and home health. So that was a really big cohort of therapists to enter into practice, and we have support from managers in Boise and then in Twin Falls to help kind of mentor us as we are new therapists. But that was made possible due to funding through the foundation, and we are incredibly grateful for that opportunity to have our class and certification. And I am also LANA certified as well.
So we thought we'd do a quick review of the lymphatic system. So the lymphatic system is actually part of the circulatory system. It's really important for our immune system. So it actually includes the thymus, the spleen, and then lymph nodes and the lymphatic vessels. We actually find lymphatic vessels throughout our body. So anywhere that your skin reaches, which is our entire body, you're going to find lymphatic vessels underneath that. They tend to sit, the initial lymphatic system sits right underneath the skin and then above the veins and arteries. It then travels deep and then is transported to lymph nodes. At the lymph nodes, that's where we're seeing the purification. So we have that filtering out of toxins, filtering out of debris, things that might be getting in the way of transport and might be toxic to our body. And then that moves up through our ducts and actually gets emptied into our heart. So what is lymphedema? Lymphedema is a regional, progressive, chronic inflammatory disease that results in abnormal accumulation of protein-rich edema, and it negatively impacts the skin, soft tissues, and lymphatic fluid. So the reason that we commonly will see lymphedema is damage to the lymphatic system or a malformation of the lymphatic system. And just real quick on the protein-rich edema, when we just hurt ourselves, so you go and you sprain your ankle, you're generally going to experience a low protein edema, but as it sticks around, the protein concentration increases and can no longer be transported, and that's when you end up with that protein-rich edema. So there are 2 primary types of lymphedema. There's primary, and that has a genetic component. Oftentimes that will present around puberty. And then we have secondary, and so we see a lot of people who present with secondary lymphedema have gone through cancer treatment, infection, trauma, or obesity. So coming back to cancer treatment, so it's not cancer itself, it's the treatment of cancer that puts you at risk for lymphedema. So cancer treatment, including radiation therapy, surgery, or lymph node removal will put you at increased risk. Infection, anytime you're loading that lymphatic system, you can overload it and create an insufficiency, and so you can't necessarily drain that limb as effectively, and that's where we come in to help a little bit. trauma and surgery. So you can see here on that right-hand side, there's a picture of the total knee. Anytime you cut through the skin, you are impacting the lymphatics, so you are disrupting them. Thankfully, they can actually kind of build around, and so that's part of what we do to kind of help. And usually it's going to be if that edema sticks around for a long time. So it's not the initial swelling that you'd get right after a knee surgery, but if it sticks around for quite some time and it's really starting to not move anywhere and the limb's getting heavier, that's when we start looking at maybe lymphedema is the route that your body has gone. And then obesity, again, coming back to the idea that you have overloaded the system, and so there's just less transport capacity with that. So there are 4 primary stages of lymphedema. Sorry if this is moving. There is stage 0, that's our latency stage. So we really don't see the physical presentation of swelling. So if I were to measure Katie's arm, it would be the same side to side generally, but she might complain of like tightness in her jewelry or tightness in the arm clothing. Sometimes a foot will have that feeling of fullness, and you'll have difficulty putting on a shoe. So cancer patients who have had a lymph node removal or radiation therapy often will fall into this category, and that's something where we encourage people to reach out to their primary care provider to talk a little bit about it. Stage 1 is a spontaneous reversible lymphedema. This is when we actually do see that swelling, and we see it disappear when you elevate the limb. So that's kind of a nice deal. However, it can kind of get a little bit complicated at this point, whether it's normal swelling or this lymphedema. We see pitting edema, and that's where you push in on a part of the body that is endematous, and the rebound is quite slow. So we see that presents during this stage 1. We don't see a lot of fibrosis or hardening of the skin yet. However, as we move into stage 2, or that spontaneous irreversible, we start seeing a little bit more of that hardening of the skin. With that, the early presentations will still have that pitting edema or that slow rebound. But as you move further into the stage and as it progresses, you get more of that hardening of the skin. This is the stage where the swelling is always present, regardless of whether you're sleeping and the leg is elevated or you're walking around. And then stage 3 is where we really see that constant swelling. We often see skin changes, including that fibrosis. We'll see hyperkeratosis, which is like increased density of the skin itself. Really that pitting edema has gone away because the skin is so fibrotic. And at some point, the lymph fluid may try to push out through the skin, and that's where we get that lymphatic fluid weeping because it has nowhere else to go. This is a picture to kind of demonstrate that. Picture on the left is like a stage 1 where you're starting to see some edema, so it does look different left to right. However, you're not seeing a lot of skin changes. It's a little hard to see here, but that middle picture, you definitely are starting to see a little bit of skin changes in the bottom part of the leg. The knee contours have almost completely disappeared. And then by the time you get to that stage 3, you can see there are different folds and things that really impact the skin and the skin's quality. And I think one of the most important things to notice is that on the right side, the leg is totally normal. The leg on the left side obviously has some lymphatic compromise, and that's where we see that lymphedema. So the way we treat lymphedema is through complete decongestive therapy. And this is what Katie and I went to school or went to that class for. There are 2 primary phases, and each phase includes the 4 components. So the intensive phase is where we're going to be seeing an individual for usually a couple of weeks, and we're seeing them up to 5 days a week. So it is fairly demanding. During that time, we're performing these 4 components: that manual lymphatic drainage, which is MLD, compression, exercises, and skincare, and we'll go through those a little bit more. And then what we do is try to teach you to be able to perform these all on your own and get you set up with the appropriate compression garments so that you can perform this complete decongestive therapy at home on your own. Our goal is to help you be independent in the management of this.
Sarah and Katie, can I interrupt for just a minute?
Please.
There's a question, or will you be addressing facial lymphedema from surgery?
Oh, we were not planning on it. There's actually an entirely different class, so an additional class that you take for the facial lymphedema. We I have not signed up for it. I know that we're both hoping to take it, but it hasn't fit with our schedules yet.
Okay, great. So thank you for letting
So,
this
and at
person know.
this time, perhaps, like if they were seeking treatment for face edema, I would recommend for the short term that seeking services either in Twin Falls or in Boise, because there are more seasoned therapists or therapists who are certified in that specific region.
Great, thanks.
Okay. So manual lymphatic drainage is the first of those 4 components. And it is a hands-on, really light pressure technique that we perform with kind of a half circle stretch and then a relaxation phase. And so we're actually trying to help facilitate movement of that lymphatic fluid from a distal body part towards the trunk. And that actually can help keep that fluid moving. Once we start the fluid moving, we can create a little bit of a negative pressure gradient and suck that fluid out, so to say. Once you move the fluid a little bit or get it moving, you really want to support it with compression. So compression that we put on individuals is not like here, it looks like it's an ACE bandage. It's not that elastic, that elastic. It's a short stretch bandaging, and we're not trying to get more constriction or more stretch out of it. We're actually applying additional layers, and that's how we're creating that pressure gradient and trying to keep that fluid out of the limb, keep it from refluxing. We start out during the intensive phase doing this wrapping that you see in the picture, and then we progress to a fitted garment. And during the day, there are 2 different kinds of materials we have for people, and generally it's going to be a circular knit, which is some of the ones that you see to the right. It tends to be pretty flexible and movable. It's a little cheaper because it's off the shelf. However, many people with lymphedema actually need a flat knit, which is a custom garment that I believe they're all made in Germany, so it's a little bit of a slower turnaround. However, it's really helpful for people maintaining the size of the limb. So once we do that manual lymphatic drainage, we try to, and the compression in the intensive phase, we try to maintain the size of the limb through the home therapy or the home phase. At night, especially once you reach that kind of stage 2, we really need to support the limb and make sure that we're not seeing that reflux at night. If your limb is just getting smaller and bigger and smaller and bigger, that is not the point. The point is to help support the lymphatic system so that you can be more functional and you can actually participate in activities of daily living. If you think about even the fluid, how much the fluid in some of those earlier pictures must weigh, it really impacts people's mobility. So at night, we're recommending commonly that people apply these inelastic kind of Velcro applications of a nighttime garment.
All right, so moving on to exercises. So Sarah talked about the treatment garments. I'll talk about exercises and skincare. Those were kind of the 4 components to the complete decongestive therapy. So exercise is very important in the management of swelling, and especially when it is done while wearing the compression garment. So the treatment goes that we decongest the limb through massage and wrapping, and then you're fit for a definitive daytime and then nighttime garment. You'll be given an appropriate kind of list of exercises that you will complete even in the wrapping phase, and then while you're wearing your definitive compression garment. And it will consist of an aerobic exercise routine and resistance exercises. And we're physical therapists, so we would pick the appropriate exercises for you, positioning, what equipment do you have, etc. What's really important is that when you exercise a certain part of your body, the muscle is expanding and contracting. The lymph vessels run right next to those muscles, and as your muscle expands and contracts, it helps to pump the piping or the lymph vessels to help them expand and contract, which helps move fluid out of the limb. When you put a compression garment on, the compression garment provides resistance to that muscle as it pumps in and out, in addition to your skin, and that further kind of enhances the muscle pumping feature, which helps move excess fluid out of the limb. So an exercise routine is imperative to helping you manage your swelling after the limb has been decongested. All right, moving on to skincare. When you have any degree, or excuse me, any amount of swelling in a limb, arm, leg, for any extended amount of time, the swelling, that extra fluid, especially the proteins, and those are an irritant to your skin. So it can cause the skin to harden. You can get small little growths on the top of your skin that can then expand. Worst case scenario, a wound can develop, but it's really just the presence of that persistent swelling in your limb that kind of degrades the integrity of your skin. So maintaining good skincare, this is during treatment and afterwards, to maintain the elasticity of your skin and decrease the risk for infections. Infections not only pose a threat to your general health, right, but they can increase swelling as your body naturally sends kind of the inflammation process to the area where there's an infection, and with that comes the potential for increased swelling. It's important for good skincare that you use an appropriate lotion, and in your first visit we educate you on appropriate lotions. Also maintaining good nail care, trying to avoid like animal bites, mosquito bites, sunburns, because all of those come with an inflammatory response, which increases swelling. And every time you meet with us, we're thoroughly checking your skin and monitoring and educating you on how to check your skin, and always watching for signs of infection. So again, in terms of management, we want to talk about you'll now have the tools on how to manage your swelling, and with that not only comes skincare and garments, but maintaining a healthy diet, and if needed, weight. There are resources within St. Luke's, specifically lifestyle medicine, which is a program that is done virtually through St. Luke's that does help you with kind of the diet and weight component. There is an exercise piece to it as well that we would pick up and provide for you. And that's something you can speak with your primary care provider about getting enrolled and evaluated for that program. In addition, wearing your compression stocking or sleeve while you're exercising or in other high risk scenarios for swelling increase, one of which would be air travel. Or if you were going to be doing a lot of, for instance, like gardening or heavy lifting, you'd want to make sure that you've got your correct garment on. Maintaining skincare and checks, lotion, avoiding sunburns and or other things that increase swelling, all of which we would review and provide education on in your first visit. Not only do we want to help your limb decongest, but in addition, provide you with the education of then how to manage your limb and notice when or what are the triggers for swelling, and if so, what do you need to do to help decongest your limb again and then get back into your compression garment. So it's a lifetime kind of management of the swelling, and we want to make sure you have the tools to know how to treat it without necessarily needing to come into clinic. All right, so who benefits from lymphedema treatment? As Sarah kind of mentioned, the risk factors, just reviewing again, any patient who's had a history of cancer therapies, or is even undergoing active cancer treatment, patients with diagnosis of venous insufficiencies, and all of these things would be diagnosed by a primary care provider, an oncologist, cardiologist, prior to you coming to see us. If you are working with the wound clinic here in Haley, Oftentimes, wound clinic will manage the wounds on your legs when they're looking appropriate to transition from wound care, but you still have swelling. We do a nice little handoff from wound care, and you come upstairs or to catch them and see one of us. We work with the orthopedic doctors, as we have a large number of orthopedic surgeries done up here. If there is any kind of persistent swelling in that postoperative limb, that's just not clearing kind of after the expected amount of time, that is an appropriate referral to us. And then additionally, any unexplained swelling. All of these kind of pathologies or diagnoses likely would be seen by your provider first. We do see some patients where a patient can self-refer themselves to physical therapy. And if we feel like there needs to be additional testing, we'll communicate with your doctor. Okay. And then, so in the Wood River Valley, so up here, I work at the Haley Clinic up on the 2nd floor, and Sarah is at the Ketchum Clinic on the 1st floor, in the building just north of the hospital. We receive referrals for physical therapy, lymphedema treatment, not only from our providers here, but also if patients are receiving care in Boise or Twin. We have established relationships with the infusion center at the hospital, the wound clinic downstairs, with the primary care providers at the Haley Clinic, and then upstairs in Ketchum. And then additionally, with the other St. Luke's lymphedema therapist system wide. So there's pretty good communication between at least the rest of us physical therapists and with the doctors as well, if someone feels that a patient would benefit from edema management. And so I would encourage you, if you feel as though you'd benefit from this treatment, speak with your doctor, or even call us first would work as well. So this is our citation page where our photos came from that are in the presentation. And then now we'll open it up to questions. These are our email addresses and respective phone numbers at the Ketchum Clinic and the Haley Clinic. So you can call us and we'd be more than happy to talk to you if you have questions or feel that you might be appropriate for this kind of treatment.
Thanks, Katie and Sarah. Can you just, a lot of our participants are outside of the Wood River Valley. So just to clarify, is their best access to information on lymphedema, again, to go through their primary care provider?
Yes, that would be a good place to start. And then there are services located in Twin, Boise, Meridian, Eagle, Nampa.
Yeah. I believe. Yeah. So we are really lucky with that. The donation from the foundation, we were able to bring so many individuals from St. Luke's into the lymphedema therapy program. So now we have them kind of throughout. I would say that some doctors are wonderful and really know a lot about this. I'd like to say all doctors are wonderful. But some of them aren't as well versed in it. So certainly if they have questions, they can always contact us. If you have questions, you can contact us and we can seek out who else might be available in those regions. I know Boise, the Wound Center has several lymphedema therapists, and that's in that Elks building by the VA. The Wound Center in Meridian, same thing. They have several. So I think if you're in that area, I would talk to your physician, see if you can talk to a physical therapist or even call the wound centers, because they're going to have pretty good sources in terms of who is practicing lymphedema in the area, lymphedema therapy, pardon me.
And one other thing that just came to mind, so lymphedema can be practiced by a physical therapist or an occupational therapist. So two different disciplines within St. Luke's, both disciplines are certified. So in some clinics, it might be an occupational therapist. We have undergone the same training. But we're two separate disciplines that can treat edema. So there might be some occupational therapists, I think.
Yeah.
In the system, yeah. But
Yeah, I know twin,
Yeah.
dev listers and OT.
Yeah.
So there's some great options there too.
Great, thank you. And I'll just remind those of you out there watching and listening in today, type in your questions. We do have a little bit of a delay between the time that we are presenting here on our end and when you hear it as participants. So keep typing in those questions. It looks like maybe we have a new one. Oh, here's a good question just came in. Do you have reputable websites to learn about lymphedema? And you might go back to that reference page. There might be something on there, I'm not sure, but anything you would recommend?
So I would definitely you can look at the LANA, the Lymphology Association of North America. I believe they even have sources there that they have highly recommended. That's the first one that comes to mind. I know there are quite a few out there. Who's the actor?
The other thought that came to mind is, so there's a few different brands of compression garments. The large, and we are not associated with these brands at all and don't get any mission on this, but Medi, MEDI, is one of the main brands that we'll use. They have education for patients and providers on their website. In addition, so does the company Juzo, Juzo, and they have more information on it as well. And the third is an education company and also a product company called Tactile Medical. And those three companies have education in addition to, like, hey, look at our products. So you can go there as well. And Erin, if we need to type those out, I can do that as well.
Yeah, that would, are those listed on that resource slide that you had?
But
No.
Can we put them in the chat?
Yeah, you can put those in the chat. That would be great.
Okay. So figure out
And
how to do that. Okay. Is that what you're, sorry to
Yep,
interrupt you.
no, please
Okay.
do it. Yeah, go for it.
Yeah, and again, anybody else out there with any questions? We had a good group on today, so thank you for joining. While we're waiting for any more questions that might come in, if you want to keep track of what is coming up in our future programs, please go to stluke'sonline.org/health talks,